Good afternoon. How's everybody doing today?
Good afternoon.
Good afternoon. So I want to be able to provide an update for you about what we know about coronavirus, what we also call COVID-19, and what's happening at the national level and the state level, and of course what's happening at the local level. So I'll give a little bit of a disclaimer before we start. This is a rapidly evolving situation. We've changed these slides, including up to about half an hour ago, we were changing slides. So this is a rapidly evolving session, and the slides are up to date as of today. We do know that as we get information in, we will push that out to the commissioners and to the public, and we will make sure that we are communicative about the changes. The data on the slides are from our public health agencies, so we make sure that we include information that is credible and that is accurate. So the data here is from the Centers for Disease Control and Prevention, the North Carolina Department of Health and Human Services, and the World Health Organization. So we'll give a little bit of background just to make sure that we're all on the same starting page. So what is coronavirus? There are many, many different types of coronaviruses. It's a family of viruses, but this coronavirus, COVID-19, is a novel coronavirus, and we call it that because it's new, and was first identified in Wuhan, China. It's a respiratory illness, and we want to make sure that it is similar to the flu, but is not the flu, and we'll talk a little bit more about that. It's spread from person to person who are in close contact. So by close contact, we mean within 6 feet of somebody, for greater than 10 minutes. So if we are in the same room, but you're across the room from me and I'm infectious, then your risk for exposure is low. So within 6 feet for greater than 10 minutes is what we mean by close contact. It's spread by respiratory droplets. So if I cough or sneeze on somebody, that's how it's spread. And even when we talk, people talk or spit when they talk, we're also concerned about that too. There's less evidence that it's spread by surface contact, meaning if I cough into my hand and then I touch the doorknob, that people are infectious, but we are still concerned about that, and we're still putting protective measures in place, but there are fewer cases that are related to that kind of transmission. So what we're mostly concerned about is those respiratory droplets. The symptoms, the three key symptoms are fever, cough, and shortness of breath. Although we know that in some mild cases, fever is not present. But those are the three that we're looking for. Overall, the mortality rate is low, around 3.4%. We also know, however, that mortality rate for those that are infected increases with age. So if you're an older adult and you are we're at higher risk, and we're going to talk about higher risk folks here in a few minutes, but mortality does increase with age. Again, although the symptoms are similar, this is not the flu. It's caused by a different virus, and so we want to be careful when we are doing testing that we are ruling out flu, and we'll talk about that. There's no vaccine for this currently. What we're hearing is that we're somewhere to a year to 18 months out from a vaccine. There's no standard course of treatment for coronavirus. Because it's a virus, what we can do is treat symptoms. So if you have a cold, or if you have a cough or a fever, we're going to treat the cough and the fever, but we can't get rid of coronavirus. So the precautions that we're taking are similar to what we would do for flu. So I said it's not flu, but the precautions are similar. We want people to wash their hands with soap and water for 20 seconds, sing happy birthday twice, and make sure you use soap and water. If soap and water are not available, and we know in many settings that you might not have access to water, alcohol-based hand sanitizer is appropriate, at least 60% alcohol. And there's no concern about superbugs, so we've got that question quite frequently. Will I create superbugs if I keep using hand sanitizer? At this moment, we want people to use hand sanitizer if they cannot wash their hands. We want people to avoid touching their eyes, mouth, and nose, and anywhere on your face, which is hard for us to do because we touch our face many times a day, but we want to avoid doing that if your hands are not clean. We also want people to avoid contact with others who are sick. So we keep telling people, if you're sick, stay home from work or school or from the public. And then we want people, of course, to cover their cough. So we want people to cough into their arm or turn their head away from people, or cough into a tissue and then throw that tissue away, and don't keep them on your desk or in your hand. So a little bit of updates about the number of cases, and this is a particular slide that I keep updating, but as of this morning, we have over 118,000 cases globally. Most of those are in mainland China. Over 4,000 deaths globally. We have more than 37,000 cases outside of mainland China with over 1,100 deaths. So a number of deaths, certainly. In the United States, as of this morning, and the CDC updates those numbers every day at noon, so we probably just missed the update, but there were 930 cases in the United States and 29 deaths. I imagine that's a little bit different. In addition, we have 49 additional cases for persons that were repatriated into the U.S., so they came from abroad and then they're here now, particularly those that were on the Diamond Princess cruise ship. In North Carolina, as of this morning, we have 12 cases in North Carolina. There are 0 cases in Cumberland County, no cases in Cumberland County. Yesterday and this week, you've heard a number of news releases about the state of emergency and this being declared a pandemic. So on the 10th, Governor Roy Cooper declared this a state of emergency. So that's an important piece because that activates the State Emergency Operations Center. It gives public health access to more resources. It makes it easier for us to purchase medical supplies if we need to do that. And the important part is it protects consumers from price gouging. So we know we've already seen hand sanitizer and face masks and a number of other products increase in price. So this declaration protects consumers from that. And it also gives health departments, should we need it, access to state funds. And I'm sure that in the coming days, we'll get more information about what that looks like for health departments. In addition, when they released declare that state of emergency, they released some mitigation guidance. And we'll go over what that guidance is because that really is our most up-to-date information about what we should be doing in North Carolina. In addition, on the 11th, the World Health Organization yesterday declared this a pandemic. So many people have thought that this was already a pandemic, but that's a very particular definition. And by pandemic, we mean that it's an epidemic that has spread over multiple countries. So in short, that we have cases in many countries across many continents that impact a large number of people. Yesterday, last night on the news, President Trump suspended travel from 26 European nations for 30 days. And there's a number of countries that are on the list. It's not all European countries, and there's some special consideration for American citizens and those that have other types of citizenship status. So we'll know more about that information, sure, here today, and tomorrow we'll get some more details about what that looks like. Okay, so I mentioned the North Carolina Department of Health and Human Services Mitigation Guidance. So this is current as of, what time is it? 1:11 on Thursday. We have got information that this might change, but this is current information as of today. So the purpose of the mitigation guidance is to slow the spread of the outbreak. So we already know that coronavirus is here in the state, not in the county, but our goal here is to reduce the spread and then to reduce the number of people that are infected. We know it's here, but we want to make sure that we're protecting those that are not infected. So the mitigation guidance defined what the CDC has declared as high-risk persons. So high risk means people that are over the age of 65, or they have an underlying chronic disease such as heart disease, lung disease, or diabetes, and that they have a weakened immune system. So they're immune compromised, they might have cancer or a disease of the sort. What the recommendation is telling us, and again, it's a recommendation, is that high-risk persons should avoid large groups of people, cruise travel, and non-essential air travel. So large groups of people includes large meetings, concerts, going to church if you go to a large church, so we don't want you to go get on the Diamond Princess cruise today or book a cruise to the Bahamas. So large scale, large groups of people is what we want people to avoid if you are in that high risk category. And for those last two bullet points, under the underlying health conditions and weakened immune systems, that's regardless of age. So even if you're 35 or 21 but you have diabetes, you're considered high risk. Also, as a part of the guidance, they've listed some information about mass gatherings and community events. So this is the guidance that the health department has recommended, the state health department has recommended. For if you have a large-scale event, we want them to urge anyone that is sick not to attend, though in particular for those that are high risk, we don't want them to attend. And then, of course, to adopt lenient refund policies. If people have invested lots of money, then they're more likely to attend the event because they know that they won't get their money back. And then when we do, if those events are held, we want to give people more physical space. So we want to give them that 6 feet away and limit close contacts where possible at the event, and then make sure we encourage attendees to wash hands and then clean surfaces where possible. They've also released some guidance about congregate living, particularly for our senior citizens, again, our high-risk persons, that those establishments should limit visitors for high-risk persons who have a respiratory illness or have had potential exposure to coronavirus. This includes nursing homes, independent living, correctional facilities, any facilities where we have medically vulnerable children. What they are not yet recommending is preemptive closure of schools or child care centers. We've seen that in the state that some school districts are closing temporarily. That is not the recommendation of the state at this time, that if there are no cases that we go ahead and close schools. That's not being recommended at the moment. Importantly, this is for travelers that are coming from abroad or from within the United States in areas that have been impacted by COVID-19. We want them to follow these guidelines for self-monitoring. So if you've been to an area where there's been an outbreak, either domestically or abroad, we want you to come back, monitor your fever twice a day, monitor your temperature twice a day. We want you to watch out for cough, difficulty breathing, and then if you have symptoms that do develop, we want you to self-isolate and stay away from other people. And then we want you to give your healthcare provider a phone call and tell them about your travel history and your symptoms, and so that they can appropriately care for you. So self-monitoring for people that travel to an outbreak area, or people, even if you're asymptomatic, or people that have traveled abroad to one of the outbreak areas. So there are several different travel warnings that are in place. So we have different levels, 1, 2, 3, and 4. And as, again, this is current as of the 4th, and so this is, again, rapidly changing. And actually, this is current as of last night. But the countries with the travel warning are China, Iran, South Korea, and Italy. And there's a level 2 restriction for Japan. And we encourage folks to check the CDC website for the most current, because that is changing on a regular basis. So what does that mean for the public? If you have gone to a level 3 country, when you come back, we want you to stay home for the next 14 days. So if you travel domestically, we're just asking that you self-monitor and you can go back to work. But if you've traveled to a level 3 country, we want you to stay home for the next 14 days and monitor yourself using those self-monitoring guidelines, including taking your temperature twice a day and watching out for symptoms. That's for level 3 countries. We want you to stay home. And typically, we are getting notifications if we do have travelers that are coming from out of state, or from one of those level 3 countries. But that happens very quickly. So if for anybody in the public, if they have fever, cough, and difficulty breathing, and they've traveled to, and there's an and there, and they've traveled to one of those geographic areas, either domestically or internationally, or they were in contact with somebody with a diagnosed case of coronavirus in the past 14 days, we want them to call us or call their local health provider. And we want them to call ahead of time so that we can, the healthcare staff can put on appropriate protective equipment. So it's very important that people call ahead of time and don't just show up. Because in healthcare settings, people are sick there and we don't want people to get further spread this. So it's very important that they call ahead of time. So what's going on with testing? That's a question that people have. Testing is currently available at the state laboratory. It requires, as of Wednesday, it requires prior approval by the health department. So if somebody's going to be tested in Cumberland County, and there are a few exceptions to this, they have to notify us or the state health department. Either way, if they're going to get tested at the state lab, we are going to approve that and we're going to know about it. And you have to meet criteria. We're not going to just test everybody that walks in the door. There are particular criteria that people need to meet before they are tested. And I've listed it here, so we'll go through it very quickly. They have to have a fever or some respiratory symptoms, so cough or shortness of breath, and, there's an and there, close contact to somebody that with a confirmed case of COVID-19 within the last 14 days. Or they can have a fever and coughness, shortness of breath. So if you have all three of those and you have a negative rapid flu test, then we will test you. You can get approved for testing. That's important because some of the tests that are happening nationwide are coming back as flu. So we have limited capacity and limited resources, so we want to make sure that we're ruling out flu or other respiratory illnesses first. We are not testing at the health department. We're approving tests at the health department, and they will be tested at the state lab. We're also assisting with specimen collection and making sure local providers will provide technical assistance to them if they need it, but we are not doing testing at the health department. So people cannot walk into us and get their test. They can't walk in to a facility and get tested at the door. We're not doing that. There's also, as of this week, commercial lab testing available. So this is not for people that are asymptomatic. So if you walk into your doctor's office today and say, I'd like to be tested for COVID-19 and you don't have any symptoms, they will turn you away. It is not for people that do not have symptoms. There are conditions that must be met to get a commercial test. So not at the state lab, but commercial testing, and that's happening through LabCorp. They have to meet the following conditions. They have to have a fever and those other signs and symptoms, so fever and cough and shortness of breath and that negative flu test. So again, we're trying to rule out other things because we know we have limited capacity. You do not have to get prior approval from the health department if you get a commercial test. However, and there's a but here, you will be considered a person under investigation if that test happens, and that person has to be isolated in their home or at the hospital. In addition, that provider has to submit to us their documentation. We call it PUI documentation. They have to submit that when the test is ordered. So if they go to LabCorp, if you walk into your own doctor's office and you want to be tested, you meet these requirements, your doctor's office is still going to notify the health department. We are going to know about the testing. What happens when somebody gets tested, if the state lab identifies somebody and they test positive, we call that a presumptive positive. So we're going to kind of differentiate in language here. It's a presumptive positive if it happens at the state lab. That triggers us into response. Our local health department staff, we're going to do some case contact investigation. We're going to call that person, ask them where they went, where they went to grocery shopping, and did they go to school, did they go to work. We're going to ask them many, many, many questions to make sure we can contact all of those people that they might have been in contact with. It also requires CDC confirmation. So once it goes to the state lab, it goes to the CDC, and then we call it a confirmed positive. So a presumptive positive and then a confirmed positive. What we are reporting now is if there is a confirmed positive or a presumptive positive in the county, we notify the public. And we'll do that on our website, and we do that through a press release, or we would do that on the state health department website as well. We are only reporting presumptive positives and confirmed positives. And as I mentioned, when we have a presumptive positive or a confirmed positive, that triggers a cascade of events. And at that moment, people's privacy, we're going to reveal some information about where they went and where they've been. So we want to be very sure before we reveal that information. And so that's why we're only reporting those confirmed positive and those presumptive positive. We want to still maintain patient privacy. Another piece of just nuance that has come up quite a bit is about isolation and quarantine. So we use the language of isolation for people that are sick, and we use the language of quarantine for people that are well, but we think they've been exposed. So what I'd like to say is if you've seen the state health department press releases, we say, we've had a positive test and that person is at home in isolation. In contrast, the Diamond Princess cruise ship, we said those people are in quarantine. They weren't sick yet, but they had been exposed and they were in quarantine. So quarantine is for sick people or for well people, and isolation is for sick people. So a little bit about the response at the state level, and then I'll jump into what's happening here locally. So the state health department is leading this effort for us, along with the CDC, of course, and they are identifying and notifying the health department about positives or people that are under investigation. We call them PUIs. They've also initiated an emergency rule that you have to report any suspect or confirmed cases. So if a provider, local provider here, or the hospital even suspects a case, that's required to get reported to the health department, and we report that to the state health department. They've also implemented some guidance that you've seen about self-monitoring, supervision. We've been through some of that today, and then they're also doing that lab testing at the state. They've, in addition, developed guidance for EMS workers, the hospital, clinics, urgent care, healthcare providers, and labs. And they've also issued guidance for individuals, businesses, employers, long-term care facilities, and different travelers. So we take that information, and then that leads into our response efforts. So as part of our response efforts, we do a weekly call with the state health department and get a status update. Following that meeting, we also have our weekly epi team meeting, and our epidemiology team is the team. You can think about it as a communicable disease team. We are the ones that are going to investigate if something happens, and they do this all the time. They do these things for HIV, for TB. They activate that team when we have outbreaks of any sort of communicable disease. We also meet several times a week, as you can imagine, in between. And then we also have 24/7 access to the epi on-call at the state. So the epidemiologists at the state level, they have an on-call staff that we can meet anytime. We also have daily executive summaries that we get from the state, and we distribute those to our response partners. And then we also distribute that lab guidance that I talked about and the provider guidance. We distribute that to our partners as well. And then we've done a number of community presentations. We have developed a website, the COVID-19 website at the state level. And then in addition, I'm going to go this way. We have a state a website here at the county level, and then we have an epi clinic that's also available 24/7. We have had several meetings with local partners, including county management, Cape Fear, the school district, emergency management, the airport, Fayetteville State, Fayetteville Tech, and Methodist, and we communicate with them on a regular basis. We've also shared information out to local providers, long-term care facilities, Spectra, Segra, the general public. We field many, many questions from the public. Our epi staff are on the phone most of the day fielding phone calls, and then also the VA hospital and child care providers, and many, many more, that too many to list here. But we are in regular communication with our partners. And then I also want to go back to this. One of the responsibilities of the health department is to make sure that we're monitoring anybody those return travelers. So again, we get that notification from the state that we have a return traveler, and then we monitor those people. So we help them self-monitor, and if we need to put them in isolation and quarantine, we'll monitor as well. And then we also work to ensure communication between all of those different partners. One of our other responsibilities as a health department is to make sure that we have wraparound services. So if we put somebody in isolation or quarantine, we know that that feels like an inconvenience for them, and so we are going to ask some very important questions. Do you have access to food? Do you have food in your house? Do you have a child in your house? Do you have pets? Who's going to walk your dog? Do you have funding? What are your lost wages going to be? So we're asking those questions. We call that a needs assessment, so we can help get them resources if they need it. So that is a lot of information. I'm going to pause. I'm going to stop there and see if there are questions.
Board members? That was pretty inclusive. Huh?
Would you go over just another minute, very slowly, the difference between presumptive positive and positive?
Yes.
That's a little bit nebulous.
Yes. Okay. So once somebody gets tested,
Once they're tested, okay.
yes. So we only talk about presumptive positives and confirmed positives once somebody is tested.
So if they're presumptive positive, they're tested.
They've been
What,
tested.
are they waiting on results?
And they've been tested at the state lab, but they have not yet been tested by the CDC.
What about somebody that's tested in lab cohort or request?
So if they get tested at LabCorp, right now what the state is doing, they're working with the LabCorp to confirm their first few tests to make sure LabCorp's got it down correctly. And then those folks are also going to have to get those confirmed at the CDC. So they're still considered presumptive positives at LabCorp or at the state lab. Anything that has not gone to the CDC is going to be considered a presumptive positive. Once it goes to the CDC, it is considered a confirmed positive.
Okay, so nobody's confirmed until it's been confirmed by the CDC?
Correct, yes.
Mr. Chairman, because of the newspaper article and just some phone calls we've got, clearly the health department in the state is going to notify of any positive or presumptive positive here in Cumberland County.
Absolutely.
And we're going to do that by, I think,
We're going to do that. We'll put out a press release, and we have a website, and it will go on the website. And then the state website also has a ticker, a tracker, and it will also go on the state website.
and made available to media.
And made available to media, absolutely,
Okay.
yes,
Thank you.
absolutely.
Thank you, Dr. Green. And I know that this is very fluid and we're all learning every day as we go through on this, but so do we know how long that this can be dormant in your system before it becomes fever?
Yes.
And then typically, and I know each person is differently, but when the fever is passed, is the coronavirus in your system passed?
Great question. So 2 to 14 days is when we expect to start seeing symptoms. So if I am positive and then I transmit it to you, within 2 to 14 days is when we're going to start seeing symptoms. If we put you in isolation or quarantine, we are going to do that for 14 days. Even if after day 3, your fever went away and you feel better, to be on the safe side, we put you in quarantine or isolation for 14 days. And then after that, what we know now and what the evidence is telling us now is that then you can go back to work, you can go back to home. And frankly, they're asking for we need to confirm that need a negative test before we take you out of isolation and quarantine. So we will, if you have a positive flu test or a positive test, 14 days is when you're going to be in isolation.
So there's been a lot of talk about a large portion of the population may have had these symptoms and may have gotten better.
Right.
And on their own and felt
Right.
like, okay, like all of us have
Yes.
done with the flu.
Yes.
And said, okay, I can go back.
Yes.
But what I hear you saying is, even if you are self-isolating yourself and you haven't gone to the doctor and you're fighting your way through this, and you're a young person without all the symptoms, that best practice is when you feel better, stay home.
Right. So, for example, if you what we're asking people to do, if they've traveled to one of those high-risk countries, those level 3 countries, when you come back, we want you to self-isolate for 14 days. Even if you feel better, even if you feel like going outside and going back to work, we're asking you to stay home for 14 days if you've been to one of those level 3 countries. If you traveled domestically, but you were in an area where there's an outbreak, we're not asking you to stay home from work. But what we are asking you to do is to self-monitor. You can go to work for 14 days. So that's the number there that we're looking for. Regardless of whether you feel better or not, we're going to self-monitor for 14 days. And that helps us to be sure that we're catching it. Some people, like you said, some people have mild symptoms or won't have symptoms at all. But we want you to avoid transmitting the virus even if you aren't symptomatic.
So does the coronavirus leave your system when you are after 14 days if you feel better?
Right, so it's similar to the flu. We still need more evidence about this, but that's what we're thinking. That's what scientists are thinking, that it's like the flu. Once you have it and it's over, it's over. But the flu, we're getting into kind of the details now, but the flu evolves every flu season. And so we're not quite sure what coronavirus is going to look like next year or if we will have coronavirus next year. But the flu evolves every season. So that's why we ask people to get their flu shot every season, because it's a different virus. So we're not sure what it's going to look like next year. But our best evidence right now is that, once you have the virus and you're clear those 14 days, you're good to go back to work and you're okay and it's left your system.
Is it like the flu that do we have the information now? Could you get it again?
We don't know that yet. That's a great question. That is a really, no one's asked me that yet. We don't know that. We don't know that if you've had it. We don't know yet. Yeah. I was trying to think of a comparison to flu, but we don't know that.
There was an earlier slide that said that all notification would come through the public health department.
Yes.
But the one before that said public health department and hospitals. So it's all information from,
It's all going to flow through the health department. So if you have a test, so let me go back a couple more slides. So when we declared the state of emergency, it required, and when we, actually this was several weeks ago, it requires anybody that is a suspected case, even if you haven't tested positive yet, or if you are a confirmed case, to tell the health department and to tell the state health department. Everything has to come through us,
including the hospital.
including the hospital.
All right.
Yes, including the hospital. At whatever, even if you get tested commercially, you can get your own, if you get tested commercially, it doesn't require approval from us, they still have to notify us. When they submit, if they go to the LabCorp and they order a test through LabCorp, their second call needs to be to the health department to tell us that they ordered a test.
Is there a dedicated line? Do you have enough personnel?
We have, epidemiology staff that are trained. We also have a surge capacity plan, so if we get beyond the point that we're not able to field those phone calls anymore, we will bring in our nurse supervisors, and then we'll bring in our school health nurses. And if we can't, if we have too much, if that's not enough, we'll call the state. Actually, we'll call Gene Booth and request to emergency management additional assistance through the state.
Well, you shared a lot of information.
Yes,
With us. I appreciate your notifying the Board of Health
yes,
on a regular basis, because the information that the Board of Health receives
yes,
is excellent.
yes.
Information, and you are in high demand. Make sure you wash your hands.
Yes, yes, I do, yes. I wash my hands, I have hand sanitizer on my desk, so I do that frequently.
Literally, but not physically.
Yes, yes,
Physically, but not
And we
physically.
are
Yes.
having trouble getting sanitizer.
yes.
Literally, not physically.
And we know, and we've heard that from the public, that people are having a hard time getting hand sanitizer. And so we encourage people to, again, I keep saying, be prepared but not scared. So we go buy your hand sanitizer. You don't need to stockpile a year's worth of hand sanitizer, because then it takes away from our senior citizens, those that are immune compromised. We want to make sure the people that need it have it. So get some for you and your family, and that's it. We don't need people to stockpile.
I did hear you say 50% alcohol.
60%, at least 60% alcohol. So when you look on your bottle of hand sanitizer, it should say at least 60% alcohol.
It's 30 proof.
Yes,
Thank you so much. This is
Very weak.
guaranteed to be taken.
yes, 60% alcohol.
Yes, it's very weak.
Thank you.
Yes, absolutely.
For the board's information, Dr. Green and Dr. Dwayne and Dr. Fairclough were all on a conference call with Congressman Hudson's office a couple of hours ago. And I heard Dr. Green say, I want you to comment on this, if you will. A lot of people are presenting themselves at local providers.
Yes.
And the providers are saying, go to the health department. That's basically what they're doing. And then on the slide, it said, but the health department's not doing any testing.
Right.
So, tell us what to do.
So we need people to call their local healthcare provider, call their local health provider ahead of time. They should help get your specimen collected. Again, if you meet those criteria, now if you don't meet the criteria, they're not going to do it. But if you meet the criteria, we need the health providers, and we've sent this guidance to them. They're going to collect the specimen, they're going to rule out flu, and then we can send that specimen up to the state lab. So what's happening is we've got a few people we've heard from the public that are concerned, and they've gone to their provider, and then they'll say, well, my provider told me to come here. We need people to go to their provider, or if they don't have a healthcare provider, they can go to the emergency room. Again, call ahead so that the emergency room can be prepared and EMS can be prepared. And then we will help coordinate with them to get the testing done if it's approved.
I guess I got one last question, because you said specimen. What is the collection process? Is it a swab? Or?
Yes, it is a oral swab
Okay.
and a nasal swab.
Gotcha.
Yes, oral and nasal swab.
Thank you.
So we'll collect that, and then we will, or the either the provider or the hospital will collect that, package it, and send it to the state health department or LabCorp.
One other thing, I'm just curious about this, and we'll take advantage of your presence, I'm sorry, but, you know, we've all had high school biology here in North Carolina, and we all cut up things. How do they make a positive test for coronavirus? Is there a litmus test, or do they actually identify the virus under a microscope? What happens? What physically happens?
Right, we need to be able to identify what the virus is, and that's why we get the swabs. And then they're going to send it to the lab, and then we need to be able to look at it, and they have an assay that they run, and they run a chemical test. That's not I'm trying to think about the easy way to explain it.
I think I understand.
So they-
In other words, it's not necessarily the physical way it works.
Right.
There's a chemical test that.
Right, we're going to run a lab assay. So it's not, so we could see HIV, or we might be able to see other STD, not HIV, we could see other STDs under a microscope, or if you have a urinary tract infection, there are some things that we can see under a microscope. This, we have to run a lab test on, and before we can get those results back. And so the time for that lab test takes some time, and it's going to be dependent on the capacity of the lab that day. So somewhere between 24 to 72 hours. So when people say I got tested at the door and they told me I had coronavirus, the lab doesn't work that fast. The courier can't even get it to the state lab that quickly. So people are not getting tested at the door. It has to go get packaged and go to LabCorp or to the state lab.
Okay, so right now it's going to take a couple of days.
It's going to take a couple days.
You know, Myron Pitts put a little thing on Facebook that somebody has got one under development that'll get it done in 8 hours.
So I have not seen that yet, but I wouldn't be surprised if it's coming. I mean, many people are working on this. You know, other countries had lab tests and had tests developed, and then the CDC wanted to be sure about our own lab tests, so they developed their own testing procedures.
One quick follow-up question. This is the latest in a long list of coronavirus.
Yes, absolutely.
You can go pick up Lysol at the
Yes.
Walmart. It says coronavirus.
Yes, different coronavirus.
Exactly.
Yes.
So what's different about COVID-19?
So there's a different, I should have put that slide in there. So it's a different makeup. The virus looks different. And the one that makes this different than the other ones is that it's novel. And so we haven't seen it before. And the tie to this one is that it was found first in Wuhan, China. So the other ones that you might have heard of are MERS or SARS. Those are also coronaviruses that were, and sometimes people call this SARS-2, which I admittedly, the language gets confusing because we keep calling it different things. But this one is a different virus than SARS or MERS, but in the same family of viruses.
It just seems to be, you know, some people say it's media frenzy, but, I mean, it's the real deal, obviously,
Right.
to us. And I don't know what to believe.
So we want, again, we want people to take appropriate levels of precaution. We don't want people to be scared. We want people to assess their risk. If people want people to travel smart. If they're older adults, we want them to stay off the plane, stay off their cruise ship. But if you are a healthy adult citizen or even child, we want you to, you know, before you get on the airplane, we want you to wash your hands, try to sit. I don't think it's a problem getting a seat on an airplane these days. Do that social distancing. I don't think anybody will shake my hand these days. So we want people to take appropriate precautions before, smart precautions. We don't need people to go buy 12 boxes of masks. That's not going to help protect them, and it actually just, as you've seen, makes it more difficult for healthcare workers to get it. So appropriate, smart precautions.
Anybody Anybody else have any other questions for Ray?
Since Dr. Green is in such high demand,
Oh, I know.
I think
We thank you so much for coming and taking time with us.
Absolutely,
We've
absolutely.
been looking forward to this, and I know Mayor Mitch Coleman is looking forward to you or one of your representatives
Yes.
briefing their board as well, please stay in touch with us. Do you have a few minutes that these folks can talk to you?
Yes, I think so. Yes, we do.
Okay, can y'all take her out for about 5 minutes and speak to her? Okay, I'm going, for the rest of the board, I'm going to declare at least a 5-minute recess, a little longer.
thank you.
Thank you.